Children are notoriously unfiltered. They will say whatever comes to their mind for the most part, and that makes for a fun day. When I was about 8 years old, my dad asked me what I wanted to do when I grew up, and so I was like, oh, I want to be a pediatrician. I am Dr. Iesha Draper, general pediatrician for Iesha Healthcare. Iesha Healthcare is a federally qualified health center that provides a wide variety of services to our community, whether that's services through medical, dental, obstetrician. It's just a good catch-all. We provide all the vaccines here, regardless of a patient's ability to pay. The Vaccines for Children program helps us to do so. And so whether they're insured or not, vaccines are covered 100% here, so that's a great thing. We talk about vaccines starting from that very first encounter, that first visit. I try to see where they're at and why they're opposed first. Let them know that, number one, I'm here to support your child. I know why you're afraid of doing this. You heard this, and I know that can be scary for you, but here's what I know about the vaccines and why they're safe and why they're effective and why we want to treat your child to protect them against these illnesses. I don't force the issue that very first encounter because they don't know me to change their beliefs. So I allow them to get comfortable with me as their physician, allow them to see that my whole goal is keeping their children healthy. I do always say our first encounter, I am pro-vaccine. I support every vaccine that is recommended by the vaccine board and on time schedules, but I will work with you. I will respect your decision, but I will always ask you about where you at with this decision. How can I help you to understand it better? So it's that dynamic of partnership and making the family comfortable. I don't get paid differently if your child is vaccinated versus not. My goal is to keep your child healthy. I would also say just take it from more of a human aspect, or if you are a parent or even you have children in your life, as a pediatrician, your goal and your priority are children. Make sure they're aware that you would trust these vaccines for your own children. Give them the assurance that you're not recommending anything for them that you wouldn't do for yourself. I think parents do feel overwhelmed with the actual injections. It's nice if facilities can stock the combination vaccines. When you can reduce those number of shots, it's always gonna be nice. Their body can handle it. It's better to do multiple shots at once instead of bringing them back repeatedly. It is painful, they don't love it. If we get it all done and give them a break in between, it's better than them coming and getting one here and two there. Parents will come to me and say, oh, I read this book and this is the schedule that they recommend. I try my best to educate them onto why we have the schedule as it is and that I support the ACIP's current schedule, and I prefer that they do the vaccines as recommended. It's really about building those relationships and showing the family that you're committed to them, and your goal is to help them to make an informed decision about vaccinations. This is the community that I grew up in. I want to be that someone making a difference. I think just giving back, letting individuals know that whatever you put your mind to is possible. There are resources and people that do truly care.